Welcome back. National Healthcare Decisions Day is coming up, which aims to educate medical providers and patients about the importance of advanced care planning. Dr. Mark Meeker, the Vice President of Community Medicine for OSF Healthcare, joins us now to share more. Good morning.
Good morning.
Thank you so much for coming in. So, what are the goals of healthcare planning? And can you just explain that for our viewers?
Sure. The ultimate goal is just to have an understanding between a person and their healthcare team about what their desires are, what their goals are. Different people have different priorities. So we need to understand those priorities because it directly impacts the care plan that we develop.
That's right. And what is the responsibility of the physician in these situations?
Well, I think the first responsibility is to have the conversation. And it really is an ongoing conversation, but it's really our role to educate people on what their health situation is, what their prognosis is, what they can look forward to, what some of the pitfalls might be, you know, and when we develop a care plan, there's pros and cons to everything. So it's really our job to make sure that the person has an understanding of those pros and cons so they can make an informed decision about what they want to do.
Right. And I know sometimes decisions can be difficult, the conversations can be difficult. So when should they happen?
This is really an ongoing conversation because circumstances change. So, you know, if someone develops a chronic disease and you have a care plan, but then something acute happens, the plan may need to change. So it really is an ongoing conversation between a person and their healthcare team to make sure everybody stays on the same page and that the goals are kept in mind. It's not too hard to drift off course if you're not careful. So it should be something that's reviewed frequently throughout the course of treatment.
And can you tell us a little bit more about why National Healthcare Decisions Day is an important day, something that has, you know, expanded across the country?
It's really about awareness because this is not at all about rationing or withholding care or anything like that. This is really focusing on providing the right care in the right place at the right time to make sure we're matching up the care plan with what the patient's goals in life are. So it's really about education and awareness because too often these conversations don't occur. And then you get into an acute situation and maybe you go down a path that the patient would say, I really didn't want to go down this path. But there was no communication to prevent that. So it's really about awareness to make sure the patients are talking with our care teams about what their desires and goals are so we make sure we stay on the same page and go down the right path.
Awesome. That's really great advice. So what resources does OSF have?
The best resource we have is our care teams. I mean, to have a conversation with your primary care physician or advanced practitioner about your goals of care. You know, what's important to you? Is it longevity? Is it quality? Are you worried about side effects of treatments? Are you worried about, you know, outcomes of the disease itself? Have those conversations on an ongoing basis to make sure everybody understands what the goals are.
Thank you so much, Dr. Meeker. That's extremely helpful. And we'll be sure to have all that information on our website at 25newsnow.com. Be right back.